guess an extension of that is, does your injector know when to say no or suggest an alternative treatment?
I have had patients who've come to me because I've told one of their friends no, and they've instantly gone, I can trust her.
I need to see this nurse.
I need to see this nurse because, and again, it's twofold. There's moral and ethical considerations there.
Yeah.
There's anatomical safety.
Yes.
And again, living where I live, if you went to the pub on a Friday night and you saw a girl with giant lips and you went, oh my God, who has done that?
Kylie's done that.
You're not coming to me. That is my brand on your face.
Exactly.
So that's super important. Yeah, so it covers a lot of factors. But yes, I think it's super important to say no for multiple reasons. Patient safety first, ethical and moral reasons, and also everyone does have a different aesthetic. I know some injectors who do beautiful, big, bold lips, and they're gorgeous.
Stunning.
And if that's something that they're really good at. So like everyone's got their own thing as well. Yeah.
Exactly. Yeah. And I think it's really something really powerful for patients to understand is that when injectors saying no to you, they're saying no to like putting food on the table for their family. So when they're saying no,
a sale essentially.
They are putting your safety, your aesthetic outcomes before anything else.
Yeah, I think that's really important for them to understand.
Yeah.
Yes, they could go somewhere and have it done, but hopefully they will trust you enough to stick with you and appreciate that.
Totally. And then suggesting other things too. Like we've all had the patient who's, sat on the bed and they're wanting another mil of lip filler. And then sometimes just going, you know what, that's not going to look quite right. Can I suggest? And they go, oh yeah, that's always bothered me, but I've never really asked about that, or like the last, 3 injectors didn't really sort of talk about that. So there is that fine line between obviously not, going overboard.
Yeah, but then
do
also appreciate it.
Can we maybe, because it's not going to look that good if we go putting more and more in that one spot.
And once you've engaged that trust, it's such an easier conversation to have. Yeah,
totally.
Often if it's nasolabial or mid-face and you're saying, you've actually lost a lot of volume up here. Can we look at restoring, and then just explain to them the physiology of aging and why they might be looking heavy in a spot because they've lost volume in another spot. And then they go, that makes sense. And no one's ever explained that to me.
Exactly. Or I didn't know that was an option.
Yeah.
Totally.
And that's a very important conversation.
Yeah, absolutely.